everyone, Dr. Tori here, and Ollie. He's such a good boy. But a lot of people have been asking about how do I know if my dog is like acting off or like what's their normal. So I'm gonna teach you guys, or I'm just gonna show you guys how to do like a basic physical exam. It's super important to know normal before you can know abnormal. So I always urge my clients like, take a look at their eyes, like what do they look like? Take a look at their ears, when they're not having issues, so you know that if something is abnormal, you can pick up on it faster. So when I do my physical exams in the office or just kind of checking my dogs, I do nose to tail just so that I don't forget anything. I probably will forget something, hopefully not in this live, but just to give you a basic rundown. So hopefully Ollie will, he's pretty good. So the first thing I do, like I said, I go nose to tail, is check their nose. His is cold, it's a little wet. Huey's, my French Bulldogs, it's a little bit warmer and it's a little bit dry, but that's their normal. So, so it's wet and it's cold, that's his normal, great. And then I look at his mouth, I look at his teeth, I look at his gums, and I also open up his mouth to look at the roof of his mouth, if possible. And underneath their tongues also. What I'm looking for are masses, abrasions, like lumps, bumps, any gingivitis, anything like that. So normal dogs should have pink membranes. Ollie's a little bit pigmented, so it's really hard to see. His is black right here. So his tongue is nice and pink though. And hopefully on the other side we can see, again, it's pigmented. There's a little bit of pink back there, but gums should be nice and pink. So yes, so look at their teeth, look at their back teeth. Is there any inflammation, gingivitis? There's some tartar on his teeth. And again, look at the roof of his mouth and underneath his tongue. And then I always take a look at their eyes. So I'll kind of try and do this like for you guys. So I look at each individual eye. His sclera, is it white? Is it red? Does he have any discharge? Does he have any extra tearing? Is it super goopy? If so, what color is it? Again, looking at both eyes and then looking at the eyes together and just making sure that they have symmetric pupils, that they look the same. So one's not like super dilated, one's super constricted. That's always something to look for as well. So again, looking at the eyes, looking at the whites of the eyes, looking at any discharge, just to see again, like what is their normal, what is their abnormal, and looking at them together just to make sure that they are symmetric. And then I always feel they have some salivary glands and lymph nodes right here, and you can feel them. Huey's are a little bit bigger, but Ollie's are, they're smaller, they're symmetric, they're smooth. So just feeling those can really indicate, or you can feel they're normal. So if they ever get big, then something's wrong or something is going on there. And just kind of like feeling down here as well. Their ears is the next one to kind of look at. So looking at, the top, the inside, the fur right there, it's not very red, it's not very inflamed. Also, my clients think I'm crazy, but I always smell ears because you can get so much information from smelling ears. His smell good, his smells they don't smell like anything, so that's good. If you've ever had a dog with like a yeasty ear infection, you definitely know what that smell smells like. And then moving down the neck, again, just kind of feeling, we felt these mandibular lymph nodes, and then going down to the front of his shoulder. There's some pre-scapular lymph nodes. I don't feel them on him. Some dogs you feel them slightly, but I don't feel them on him. So that's good. And then just doing a little bit of like a cursory forelimb check. You want to check their joints. So I always do kind of like this wrist, this carpal joint. Their elbow joint, you want to flex and extend. I'm not doing this very well because it's a little bit awkward to do in front of the camera. But also the shoulder, you want to flex and extend as well. And you want to do that on both sides. Is there something different? Is one side stiffer? Does one side hurt? Does anything kind of like crinkle or pop or anything like that? Is there any swelling? And just kind of rub down their front limbs as well. And then moving towards the back, you can check their neck, so just kind of palpating around there. You can do light to medium pressure, and then I always kind of move their necks up and down, back and forth. Are they sensitive? Are they resistant to go in one direction or the other? And then pushing it down. Do they let out a yelp? Are they like super stiff, super sore? That can be really telling as well. And again, you're just kind of trying to find their normal so that if something is off, you can pick it up more easily. And then always just kind of like run your hands all over their trunk, their forelimbs, their chest, everything, you know, on their bellies, just to see, are there any lumps? Are there any bumps? Is something swollen? Does something feel off a little bit? It's nice, again, they're symmetric, so if I'm doing this on both sides and one side feels different, then something might be a little off. But, you know, he feels good and smooth. And then standing them up, here is his, you can feel his vertebrae, and so kind of pushing on either side of the vertebrae just to see, are there any sore spots? Sometimes they will kind of like look at you, sometimes they'll wince a little bit, but just checking their backs and their back muscles that way. And then looking at their fur. So you want to go like against the fur growth just to look for any, just to look at their skin. Is there any dandruff? Are there any fleas that you can see? Are there any abrasions on the skin? Is it really red? Also, like, are some areas pigmented? And so if you see that, you know, if they're acting off, you know that if it's normal for them or not normal for them. So just looking at their fur, looking at their skin, just really getting like a good look deep down in the skin, just going against that fur is really great. And then, again, as like we did with the forelimbs, with the hind limbs, you want to flex and extend every joint. So the hip joint, here's the knee. You want to see if they're able to flex and extend everything. Their kind of ankle, hock, and their little tiny digits. You also want to make sure that you're looking at their paw pads. That can be something, if they get abrasions, it can be super painful. Looking at their nails, are any of them ingrown, or any of them chipped, or any of them causing any issues like that. So you want to look at their paw pads. You also want to move their tail around. Sometimes if they have back pain or kind of low back pain, they'll be super sensitive on their tails. Also, they can get swimmer tails, or if, you know, they're like hitting their tail or wagging their tail too much, they can get a sore tail. So you want to do, just kind of take a look at that. You can also, when you lift the tail up, look at their rectum, because that is super important too. Just to make sure that there's no like redness or swelling or anything that could be super abnormal. I'm feeling his knees right now, so they feel pretty good. And then he has popliteal lymph nodes. So here's his knee, and I'm going directly behind. His little popliteal lymph nodes are there. They're like the size of a pea. So those are some other lymph nodes just to check in general. And then kind of palpating his abdomen. So I usually take a flat hands, and while they're standing, palpate to make sure that there's no tension, that they aren't sore anywhere, they're not guarding anything. That can really help when they're having like GI upset, just to see how they feel. Also, if you do this when they're feeling fine, you know what normal is. You know that, oh, this feels like this when he's feeling great, and all of that. So then what I also really like to do, oh my goodness, is flip them on their backs so that I can look at their bellies. You have a much better chance of seeing fleas in this area because the fur is a lot thinner. So checking for fleas, checking for redness. During allergy season, they get a lot of redness on their skin in between kind of this thigh region right here. They also can like lick and create a hot spot. So you definitely want to check their fur. This sometimes is a lot easier to check their paw pads and their nails. So you want to do that as well. Don't forget their dew claw. A lot of them still have the dew claw on the front. Some breeds, some dogs have dew claws on the back, so you'd make sure you want to check that as well, because sometimes that can grow and get ingrown into the paw pad. So just checking around here. Also check their genitals, especially if they've been kind of licking there a lot. You can check just around this area, and also underneath their neck, just so you don't miss anything. And sometimes it's easier to look inside their mouth as well. So their front teeth, what does their bite look like? What do their canines look like? That type of thing. So that is my basic, just exam, what I do at home. So take this time now that we're all staying at home, just to make sure that you know your dog's normal, so that if something ever comes up, you can really say, this is abnormal, it wasn't like this before, or, you know, I felt this tiny bump and now it's grown, you know, twice the size in a couple of months. Again, preventing ear infections, that's going to be huge, especially in the next coming weeks with allergies, of just taking a look at their ears, making sure that you stop any infection before then. And again, oral health and just basic needs and just basic care of your pets. So hopefully this was helpful. There's obviously a lot more to the physical exam, but again, just getting started on what is my dog's normal. If I did the same exact exam on Huey, my French Bulldog, it would definitely be a little bit different. So hope you guys are doing well and staying safe. And if you have any questions, you can DM me or email me at info@balancedpetvet.com. And hopefully you guys, like I said, are staying safe and busy, and we'll talk to you soon.